Sioux tribe up in northern South Dakota.
Okay.
Hi.
Very nice. Nice to meet you. What's your first name?
Deb.
Deb.
Deb Arbogast.
Okay, Deb, like my name.
Yeah.
Okay.
That's a pretty good name, isn't
Speaker
it?
just hold it. Deb, D-E-B. Okay, great.
Yeah.
Very nice. Nice to meet you. I'm glad you're on the call. That's wonderful.
Yeah, it's nice to meet you too.
Are you the administrator or the director of nursing?
I'm the nursing home administrator.
Very good. Excellent. Is Joseph on the call by any chance?
I am.
Oh, good. Okay. Got your text, so. And anyone else on the call?
Ron.
Okay. Has anyone heard from Tammy?
I have not. No.
Okay. I'll go ahead and take minutes. I think we should wait a few minutes, though. Is KAI on the call? No? I'm getting an echo. I'm sorry if anyone tried to reach me the last couple of days. I lost my phone on Monday. So I just got a replacement and got it activated this morning. You don't want to lose your phone. Let me not suggest losing your phone. Ron, you didn't hear from Lisa Johnson by any chance, did you, or Teresa Holt?
I have not, no.
Okay. They've been pretty good. Did everyone get their newsletter that was sent out on the 12th, I guess?
And that newsletter was about what?
So we got our monthly newsletter. Julie sent it out about 6 days ago, and it had a lot of pictures. That's why I wondered if everyone saw that. We had the mission statement and talked about the changes in U.N.I.T.E, and the minutes were there for the September minutes for the steering committee, transition committee, and then we had pictures. The one Ron conference, and then the call information was there. So I was really pleased with that. If KA is on the phone. Oh, hey, Julie. The pictures look great, by the way.
Good. I'm glad I liked it. Yeah, it was a really good issue.
It was. I think we should try to put a few pictures every single time. Joseph and I will be at the NCAI conference in Denver Monday and Tuesday. So Joseph, we'll have to get a few pictures, and then we can send those to Julie for the next newsletter.
Yeah, that would be perfect.
I'll be attending. I don't know if you all got from John. There's going to be CMS is having a CMS ITU training here in Phoenix. It's actually Wednesday and Thursday next week, so I only can go on Wednesday. But I am going to go to that. So it's I don't have the agenda right in front of me, but there's the people. I don't know if anyone knows. Joseph, you may know Carol Ciccarello from Phoenix Area Indian Health Service.
No.
Denise Exenden Cynthia Lamech. Does anyone know Cynthia? Okay. So, I mean, again, I'm going to represent U.N.I.T.E, and if anyone has any, if I hear anything and have any questions, I might reach out to some of you while I'm there. But I will just be attending on Wednesday next week. I won't be able to attend on Thursday, so I thought I would just mention that. But yeah, it's good, really good job, Julie, on the newsletter. I think it looks great. So just to affirm, if you didn't see it, U.N.I.T.E is working to incorporate and formalize its structure with a board of directors and organization bylaws. The steering committee has been meeting to plan for this new stage for U.N.I.T.E. So I'm a little bit out of order here on the agenda, but I'll get back to it in just a second. And we have agreed as the steering committee to meet twice a month on the second and fourth Monday. So, Ron, since we're going to be in Denver Monday, I was hoping you could lead that steering call.
Sure, I'd be glad to.
Or someone, because Joseph and I will probably be busy. We might not be able to call in on Monday. So the U.N.I.T.E mission statement that we kind of came up with was U.N.I.T.E works closely with any self-identified tribe needing help to create and sustain homes of excellence. We didn't call them nursing homes. So tribal elders or those needing full-time assistance may age close to home and community. We accomplished this mission through networking, education, and training, advocacy efforts, resource production, and site visits. So we definitely wanted to put that real person piece in there. And so the minutes were there from our September committee meeting, so that was great. And then some pictures on the annual meeting, which was held in Washington, D.C. as part of the Title VI conference. So I just wanted to remind everyone, last month we did have our call on September 19th. We had Dr. Blythe Winchester on the call, Ron Ross, Ina Weed-Hurley from Morningstar, Teresa Holt from Alaska, she's the ombudsman, Jonathan Collins from KAI, Shannon Sansosi from the Carl T. Curtis. She's the deputy administrator there, and myself. And just kind of a reminder that Cynthia LeCount was our speaker. We may think about a speaker for our November call, and she did announce the new deputy director, which is Leslie Green. And Blythe spoke a little bit about the Office of Public Health, supports developing long-term support service and some tools for the advanced care planning and how that could vary across tribes. So, Julie, we did reach out to Blythe since that September meeting, and I'm trying to remember. She said that, I guess, they weren't quite ready to put something into the newsletter, correct?
Correct.
Okay. So, but we did reach out to Dr. Winchester, so I think she wants to reach out to anyone who gets the U.N.I.T.E newsletter to see who would be willing to kind of answer some questions. And this, they're trying to make a tool for tribes for advanced care planning. And we said that would be fine, but I just don't think she was quite ready to put a link onto our newsletter. Let's see, they're also looking at some palliative care initiatives for tribal nursing homes. So I think that's probably going to happen before a November newsletter. We had a QIO report from Lisa Johnson, and Ron, I'll let you kind of give an update on the nonprofit today. And we had that Deb's on the call, so Deb, you'll have time to introduce yourself and talk about yourself. And I think, let's see, and what you're doing, and I think that was pretty much our minute. Again, we talked about all of us, like, speaking up and reporting, like, the barriers and the challenges that we're having in meeting our mission. And so that might be a little section that we talk about every time on these calls so that we have kind of a target that we can work toward. All right, so that was our minutes from September 19th. I guess I should ask if anyone has anything to add or change on those. Hopefully you've all had a chance to look at them. Were there any changes to the minutes, or are we approving them?
This is Ron. I'd make a motion to approve them.
Okay, great. Does anyone want to second that, Joseph? She's still on the call? Okay. All right, so I'll go ahead. Could anyone second that?
This is Joseph. I'll second those.
All right, thank you, Joseph. Okay. So let's just go over the attendance real quick. I know Ron, you're on the call, Joseph, Julie, and then Deb. How do you spell your last name?
Sorry about that. I spell my last name A-R-B as in boy, O-G as in girl, A-S-T.
Okay, perfect. And it's Arbogast?
Yes.
Arbogast. Okay, very good. So on our standing agenda, it's your turn to talk about you. So we try to introduce new members and just kind of hear a little bit about what you're doing and who you are.
Okay. Well,
And by the way,
here.
these calls are being recorded, just so you know. They do go on CMS.gov.
Oh, okay. Well, we're here at Eagle Butte, South Dakota. We have been working towards getting our nursing facility licensed. We obtained that from the state of South Dakota September 6th. We just got our Medicaid rate from the state of South Dakota Tuesday of this week, and we are currently seeking our professional nursing staff so we can accept our first nursing home resident. The Medicine World Village has been operating as an assisted living with Kim Clown as the administrator of the assisted living, and she's sitting with me.
Okay.
And we have a gorgeous facility, and we're just super excited here.
That is awesome. How many square feet is the building? I'm curious.
I don't have that in front of me.
Oh.
We are 4 wings, and we have 26 assisted living residents. Currently, we have the ability to have up to 50 nursing home beds, but we're going to start with our 400 and 300 hall. We had to raise some monies to get those halls compliant with federal requirements with call lights and door security and IT infrastructure and things like that. And we got that late spring, and we got that work done this summer and submitted that application, and they said, go for it.
Wow. Was that financing through the tribe, or was that through like a private nonprofit, or how was that funded?
Yeah, financing through the tribe. We wrote grants also.
Okay.
Yeah. So that's how we did it.
Okay.
And now we have, we're working on a new proposal for a safety security fenced-in dementia courtyard.
Wow, good.
Yeah.
Yeah. Now, are you using the greenhouse project model, or?
No. Like our wing, it would be between our 200 and 300 wing, fencing that in, and then doing some landscaping to make sure that the ground is smooth, having a round walkway for them, chair benches so they can sit, also having like a pergola small area where it's protected from, rain and stuff like that. Then that will help us be able to meet some of those needs for the dementia residents. It is a goal of the assisted living administrator, Kim Clown, that we actually would have like an Alzheimer's dedicated wing.
Okay. So it's dedicated wing, but not a locked type unit.
No, yes, a locked, like a secured wing. Yeah.
It is secured?
It would be. That's the goal of having a new wing being built. That would be because on the 2 wings of 400, 300, we would be utilizing 30 beds.
Okay.
But the state gave us 50.
Okay.
So it would be in addition to the facility.
Okay. So, Kim, could you tell us now? Can you give me your last name again? Just spell it for the record for the minute.
It's Clown, Clowin.
Okay, and the town that you're in North Dakota, could you spell that for me too?
Okay, it's in South Dakota, and it's Eagle Butte, 2 words.
Oh, Eagle Butte.
E-A-G-L-E, yeah.
Okay, Eagle Butte, South Dakota. I'm sorry, that's what I meant to say, Eagle Butte. And then, do you guys have a website? What's your website?
It's medicinewillvillage.com. It's in the process of being put up.
Okay, but it's going to be medicinewheelvillage.com?
Correct.
Okay.
Because our facility is built in a circular motion like a medicine wheel.
Oh, very interesting. Okay. All right. And I don't know if you would mind, Deb or Kim, if we could have a separate call maybe sometime this week. And the reason I asked that is because with my work at Archie Hendricks, there was a lot of collaboration with Banner Alzheimer's Institute here in Phoenix. And every fall, in fact, last fall, our U.N.I.T.E meeting was part of their annual meeting in Tucson in 2017. And they're having their annual fall meeting again at Fort McDowell here in Arizona. And they actually called me because I've done so much work with them over the years and said, we'd like you to be on a panel talking about, best practices for dementia care in nursing homes, tribal nursing homes. And if you wouldn't mind, what I did is I had to submit just like some questions like myth or fact. That's the format they're using for this panel. Is they're going to just present some scenarios and then go with this myth or fact and then have a discussion around it. And if you wouldn't mind, either of you, if we could have a call this week yet, I would really appreciate that and just kind of go over the questions I asked, and just kind of pick your brain a little too to get some best practices and things you may be doing at your facility. If you wouldn't mind, I think that would be a great networking opportunity.
I don't have a problem with it at all. I'm not going to speak for Deb because I worked at a facility down south, and there was a 32-bed Alzheimer's unit, and I'm actually memory cared, and I sat on a panel for caregivers as the activity professional for Alzheimer's. So
excellent. Excellent.
I've been in Alzheimer's care for a long time, so I don't have a problem. I don't know what Deb's schedule is. 11 to 1 tomorrow. I'm already on a call. So she's already on another call from 11 to 1.
Okay.
So I don't know.
I could be available anytime really tomorrow afternoon. So, if you want 1 or 2 or any time that would work for you. I'm at right now here. It's like, I think you're an hour. Are you 11:15 right now or 11:19?
We're 1:20 right now.
Oh, you're ahead. Okay, right. It's an hour ahead. So we're just, So like a 2 o'clock call for you would be like a 1 o'clock call for me. So whatever works for you, I'll get your number. If you could just stay on at the end of this call, I'll get your numbers or whatever. Maybe we could just have like a little conference call or something. That would be great. I'm just trying to pull some best practices, into the, from the U.N.I.T.E into this conversation. So. And I
actually won a best practice in Alabama for validation stations in an Alzheimer's unit. I'd be glad to share that.
Oh, awesome. Okay. That would be great. Okay. All righty. That would be awesome. Okay. I got a little off there. So thank you for Deb and Kim for being on the call and for being new members. Does anyone have any change in contact information? So we'll need emails for Deb and Kim. So if you guys can, I don't know if you want to just send those directly to Julie or Ron, and then Ron can forward them, but we will need some emails and contact information. Julie, the Cheyenne tribe isn't on that list, right? It's on CMS.gov. They're not on that list, are they?
No.
I didn't think so. We'll have to make sure. When do you think that list will get updated again?
We'll probably start working on that towards the end of this year, beginning of next.
Okay. All righty. Okay, we'll just have to, just keep aware of that to make sure they get on that. And so we do not have a guest speaker today. Sometimes we do. Does anyone have any thoughts for a guest speaker with the work we're currently doing? Maybe I'm wondering if maybe Dr. Winchester could be our guest speaker for November. We could ask her to kind of give us an update, or maybe have the folks from Washington that are working on the advanced the care planning and the work with palliative care. Would you guys like me to reach out to Blythe and see if we could get them to be a speaker on our next call?
I think that'd be good.
Okay, since that's something we talked about at our annual meeting, I'd just like to follow up on that and give them a chance. Okay, so that would be, I believe, Julie, it was what, November 19th? I think it was November 19th, I'm pretty sure. Let me just double check the date, but I'm pretty sure that's our next call. I can't remember. Sorry, I don't have the calendar right in front of me, but so it'll always be the third Thursday, and it's either 3 o'clock Eastern time or 2 o'clock. So I believe in November, by the time we have our meeting, we're going to go through the daylight saving time thing. So it's probably going to be 2 p.m. Eastern on our call for November. So just be aware of that time difference. So NICOA, yes.
May I ask a question of the new people that are on the call today?
Of course. Yes, absolutely.
Good afternoon, ladies. My name's Joseph Ray. I'm a Laguna Pueblo tribal member, Laguna Pueblo in New Mexico, and I'm a board member of the Laguna Rainbow Corporation, and we administer and oversee services for a 58-bed nursing elder care center, as we call it, and also a community Title VI program and Title III program there at the Pueblo. And one of the situations we face at our nursing home is that we almost half of our residents are non-tribal members, non-Laguna tribal members. They're enrolled members from other tribes surrounding Laguna Pueblo, which is located an hour west of Albuquerque along Interstate 40. But I'm wondering if you at your new center will be serving not only Standing Rock members but other neighboring tribal members. Is that not a situation you face? Thank you.
We're actually the Cheyenne River Sioux tribe, and currently in our assisted living, we do have our Native members that are of this tribe, but we also do have non-Native in the building.
I apologize.
Yep, that's okay.
I got you guys. I got you mixed up. I was looking at Standing Rock, and then you guys are south of there. So.
Yes.
Yeah.
Yeah.
Okay. Sorry about that.
Yes, but we can have non-members in the facility also. Now, as far as our projection for bringing in our first nursing home resident is when I have the 24/7 professional nurse staffing in place. So I don't have an exact date when that's going to happen, but with visiting with IHS, which is across the street from us here, the hospital, they do have 39 possible admits for us. And from my understanding, they are all members of this tribe. But we would accept others.
Thank you for that. Well, it's a challenge at times because for specifically the Pueblo and the Navajo or Diné culture, there's a great difference that maybe you're aware of, but at times it's really created conflict within the facility because we have not only residents of our nursing home, but staff members that are of the various tribes, and at times we tend to step on each other's toes as far as the cultural aspects. related to ceremony times, especially for end-of-life ceremonies and cleansing of the rooms. So that's just, again, a situation that I wanted to share with you ladies and with the group. And it's another topic, I think, for discussion, hopefully for the future of another best practice report. Yeah, that cultural dignity. I know we've addressed it in other ways, but again, it's been rising lately, the topic in our facility, because again, the differences. And for me, as a board member and working with creating a new management contract with the management organization, that, again, those considerations really need to be given. We use an outside management organization at Laguna, and again, we need to have more organizations like Mr. Ross's that can guide us and guide tribal leaders. That's what I'm doing. That's my role I play, I feel, on U.N.I.T.E, is as an advocate with tribal leaders to make them aware of the need for consideration of planning for long-term care services for our tribal members. And as you ladies will become aware of, there are only 18 tribal facilities. Well, 19 now when you guys come online that serve over 500 tribes and their members. So again, thank you for your time.
I can answer some of that to the culture. This is Kim. When I first started in long-term care, I was an activity coordinator, and we are bound by our regulations to know the culture of all of our residents, and so we make sure if we have someone come in with different beliefs and stuff, we research that so we can provide the spirituality or the cultural differences that we share to make sure that each resident, is quality of life and quality of care, and in the manner that is with their beliefs and their spirituality and their culture. And that's rested on the staff to learn that and to execute that. It can get, I understand what you mean when you have more than one culture in a building. It can get very challenging, but there's ways, as long as you know your resident and you provide those services, to where you don't necessarily step on toes, but everybody's culture is met individually and respected that way.
Thank you for sharing that. What really I feel is needed is really more communication amongst our staff members. As board members, we were thinking of incentives to increase the morale of our staff, and some of the board disagree with that idea that we needed to reward the staff in some ways to increase morale. We feel as tribal people that it's a blessing for us to be able to provide that care, and that is the reward in itself. That the reward of coming today and serving the people that raised us and brought us forward to today. That's all they should get. They should receive proper pay, of course, and the benefits that come with that, and have the services that as employees that they deserve. And we as a board, we understand that we need to have that in place. But again, as far as incentives and trying to boost morale, we as tribal members, we as Native people we have to remember our place. That, and I'm only speaking on my part. We have to pray on it every day. In our pueblo, we use cornmeal to pray with, and we pray if we're able at the rise of the sun every morning, facing east, and we pray for everyone. We don't just pray for ourselves. We pray for the whole world, and we pray for the strength. We do actually, in the end, we do pray for ourselves that we have the strength to do our work. And I think that's what we're losing with our staff. Our line staff, our CNAs, they take cues from the leaders, the department heads, and when we don't have strong department leaders, then I think that's where we're failing our younger employees, because they need to be reminded daily of that fact that those elders are the reason they have jobs. So,
Yes.
Again, that's my little piece. Thank you.
Thank you. Yeah, I talk to my staff on this a lot too, and that's how I remind them that they're the reason we're here. And I agree with you on staff incentive and to keeping morale up, and it's a challenge for any administrator. And you're right, you have to have strong leaders to set examples to staff, and we talk to my staff, and we have culture in place, and but I agree, staff morale and staff incentives, those are all part of the care. And even though being able to care for them should be incentive enough, but still, frontline staff they're the backbone of the community itself. So, you do have to set the example and step up and show them they're appreciated, and boost their morale, and just remind them why they're here, and congratulate them for a job well done, and use your spirituality, the cultural spirituality in it as well, because there's a lot of the young people that kind of moved away a little bit. So you got to kind of remind them, why we're here, and their traditions, and what their family has taught them throughout the year too. So I understand your issue or your challenge with that as well. But I agree with you 100%.
Well, thank you for.
Do you have a cultural coordinator? I'm sorry.
Who, me?
At your facility, your new facility, will you have a cultural coordinator to kind of remind of some of these traditions?
No, we don't have a cultural coordinator, because we have the Lakota values that we do post and they're reminded of, and we do have spiritual leaders come in.
Okay.
We have end of the life things, and we go by the teachings of our elders here, and we seek out information when we need it, and move forward that way.
Okay.
As a board member, and as I referenced earlier, the fact that there are so few entities that understand how to deliver services properly in tribal communities. In Laguna, we've been recruiting for years to find our own tribal member to be a candidate for nursing home administrator to get their licensure, but no one has stepped up. I've been a board member for 2 terms now, and it's always been, the chairman has received direction from the board to reach out to tribal leadership to, again, assist us in finding candidates in that maybe are working in the tribal system to come on board at the nursing home. But again, that's another challenge that we're facing now, and so we're getting ready to hopefully bring someone on in that role. But again, it's taking time. So thanks again.
I've been taking notes, just so you know, because I don't want to lose some of that information. I think that challenge that you just brought up, Joseph, about training, like getting tribal administrators and the whole what is involved in that. And I think that is one of the visions of U.N.I.T.E, is that we also would be some kind of a training center where some of these type of things could be addressed, with staff prior to their going and showing up for an assignment, that they would have this kind of thoughtful training, and not just competencies, but also the cultural competencies piece of that. So I appreciate everything you all said. Where are you hiring from, Deb and Kim? Where are you going? Just are the staff at the hospital going to be cross-trained, or what are you doing with that? Is she still on the call?
Oh, sorry. Can you hear me now?
Yeah, I think you were muted. I just was asking in terms of hiring what your plan was. Were you cross-training some of the nurses at the hospital? Are they going to be going back and forth? Or
I don't think so. We did place ads, local ads for nurses. We didn't get anyone responding, so I have it in surrounding communities. I also have it on our South Dakota Job Service. I did just get numbers from contract staff also, but I think I found basically just personally visiting with nurses because I'm a nurse also.
Oh, okay.
So just friends, and that's where I found the most interest. So that's our challenge, is to get all those nurses or the professional staff on board.
Mhm.
So right now, that's where we're sitting. So if I had them on board, we would be taking our first residents probably Monday morning.
Right.
But that's where we're at.
Excellent. And that is a challenge, and we have talked about that. So just for you and Kim, every year we have our annual meeting, and we pick kind of a clinical and a non-clinical topic at our annual meeting for the coming calendar year. And so for this year, we chose we're going to continue with the sustainability of tribal nursing homes since we're working so hard at, formalizing U.N.I.T.E. And then the non-clinical piece, we're looking at some of the younger, so for example, some of the younger residents that need also more long-term care because of whatever. It could be addictions or accidents or whatever. So we're kind of looking a little bit at that disability piece. But we certainly, over the years, have talked very much about this issue of training and cultural competency and, looking at how do you staff, how do you keep your staff, right? Not only we talk about consistent assignment, but you can't have a consistent assignment if you don't have consistent staff. So, and I know Ron talked quite a bit about benefits and pay and things like that too. So when you said you got your Medicare, do you get your Medicare rate or your Medicaid rate?
Medicaid rate for the state of South Dakota.
Okay. Ron, would that be enhanced then? You got the enhanced Medicaid rate?
Actually, South Dakota came through for both Cheyenne River and Rosebud this week. We've been working with South Dakota for a long time, and both facilities got an enhanced rate as of Tuesday.
Wow, congratulations. And congratulations to Ron, because, he knows what he's doing, and if you listen and follow through, that's incredible. That's wonderful. Congratulations. So we can continue to ask questions. I just briefly go through a couple other things on the agenda and give Ron a chance to kind of update everyone. NICOA, I have not heard from Randella. Has anyone heard anything from NICOA? Anyone reached out to Randella Bluehouse or anyone from NICOA? Okay. The NCAI mid-year conference will be in Denver this coming week, and Joseph and I will be there Monday, Tuesday. Joseph, you want to just give them a quick update on what we're going to be doing there?
Sure, Debbie. At the National Congress of American Indians, they have opportunities to visit with tribal leaders from the various regions from what we call Indian country. And so just to, again, raise my mission to raise the awareness and raise the profile of U.N.I.T.E. amongst our tribal leaders. Just speaking recently on a local level in New Mexico, many of the tribal leaders have various thoughts and ideas about how they are going to create long-term care service departments or programs, or how they're going to add to what they already have established. And so, their thoughts are, of course, they want to keep their elders at home. And unfortunately, maybe, well, fortunately for some of the richer gaming tribes, they can afford to build those facilities and not worry about the bottom line. But we also have tribes here in New Mexico that aren't gaming, and they have to use their resources, wisely, and so creating or building a facility that's going to house those aging populations might not be feasible. In New Mexico, we have 22 tribes, and amongst the pueblos, we have them broken down into various regional, local groups also. We have the 8 northern pueblos group. We have the southern. We have the 5 Sandoval pueblos, and then we also have the larger group called the All Pueblo Governors Council, where I'm attending today. And again, at NCAI, these leaders will be together in a relaxed setting where we'll be able to focus. We'll be able to get time, private time actually, with them, away from this formal meeting type setting. There is a formal agenda for the regional meetings, of course, but they give an opportunity for groups like U.N.I.T.E to come in at the last minute and present our issues. And as we all understand, this is a very important issue. And when we talk about elders, that their ears usually open and eyes open and all that good stuff. There isn't a plan. There isn't a united plan out there for tribes how they're going to address these services. And Ron, you can back me up. It's a loose I guess you could say it's a patchwork of ideas that tribes have supported and put forward, financed. So again, there is not one plan out there. Everything's all over the place, all over the board. And so I think as U.N.I.T.E grows, so will this movement of supporting our elders locally in whatever fashion it might be, bringing together the various resources that we as tribes have at our disposal to create those living situations for our elders, through the grant process, through foundation, through the creation of new organizations that will support these ideas. Again, that's why I feel that our time at NCAI is well spent. U.N.I.T.E is growing, and I think if we can reach those tribal leaders now, they're always transitioning. So this process is needed ongoing, yearly, monthly, almost, to educate tribal leaders about how they can assist U.N.I.T.E. I feel that's how we're going to grow, is by having tribal leaders on our boards as part of the decision-making process of U.N.I.T.E. Those tribal leaders might not know it now, but the more we work, the more we meet them, we'll find those champions, I believe. I have to believe that because, again, I'm working on behalf of my elders. So thank you.
Mm-hmm. Thank you, Joseph. That's excellent. I've just been writing some things down, too, that you said. I think finding the champions and, like you said, having the tribal leaders on our board, that's going to be really, really powerful down the road. And, creating, like you said, creating those living situations. And there might not be one, like you say, someone might not, maybe the money isn't there to build an Archie Hendricks or what Deb and Kim just did, but there's other options, right? So you give them, you step them through, okay, here's, it's like I think of a young teenager, deciding what they're going to do with their life. I mean, there's not one size fits all, right? They can go to choose different colleges, different programs, maybe not college. There's different options, but the thing is, like you said, to serve the elders and to keep them, local, supporting them in their communities. So I think that, kind of bringing together these patchwork of ideas is kind of what we're about. So that's really excellent, Joseph. I can probably incorporate some of that into our mission and vision statement. Okay, so thank you very much. The National Indian Health Board, the only thing, we've had a little outreach to them with some follow-up I did after the conference that Cynthia LeCount had sent me some people that I reached out to. So I did have a little bit of, got U.N.I.T.E out there a little bit with the National Indian Health Board. I am no longer serving on the Geriatric Workforce Enhancement Program, although it is still active at least through June 30th of next year. I don't know about Dr. Lewis in Anchorage. I'm pretty sure that GWEP was funded for one more year too. I'll have to check with him. And do we have anyone from the QIO or Ombudsman on the call today? Okay. Julie, you want to give us a quick update on the best practice report and what we decided?
Hey, Debbie, this is Jonathan. I think Julie's actually had to step off for another call.
Okay, that's all right.
Excuse me, sorry. Just getting over a cold. But the only, I know that you and Julie had a conversation and that you were reaching out to a few folks to line up interviews. I
did get a couple of people come back to me with social workers because we had wanted to interview social workers. Yeah.
Have you forwarded that to Julie or?
Actually, I was just looking at that email today. I don't think they included Julie on it, so I need to forward that to her. I will.
Okay.
I think I did.
That'll be great.
I think I had forwarded Light's response to Julie. I'm not sure.
Okay. I will.
But can you go over just what we talked about when we had that call, just what we decided? Do you have that?
I don't have that information.
Okay. We did have a meeting I think it was last week, right? It was after our steering call, because we talked about this on the steering call. And we did discuss we discussed doing a series. So our next practice report is due December 1st. And then there'll be 3 more. It's basically they're done quarterly, and they go on CMS.gov, and we've done them before. This isn't like the first time. We usually do some kind of interview. And we did talk about doing surveys, but it was kind of late to do a survey of tribal nursing homes. Although, honestly, Ron, with our nonprofit and stuff, I think we're really going to have to look at doing some ongoing surveying, really, of our 19 now tribal nursing homes. I think we're going to have to do that. But so we're going to do a series of reports on our clinical topic for the year. So we're going to look at a little bit on trauma-informed care, which, of course, I'm sure most of you know is real big in long-term care right now in nursing homes under CMS regulations, and then looking at, kind of people that come in, maybe they're a little bit younger, maybe they have a history of some kind of trauma. How are we caring for them? And so Julie was actually going to interview some of the social workers. So, Deb, if you do hire a social worker for your facility, just let me know, because we're looking for social workers to interview.
We do have a social worker already on.
You do?
Board.
Okay.
Yeah.
If you wouldn't mind, my email is D like Delta, J, D like Delta, and then my last name, Dijak, which is D-Y-J-A-K, like Jack, but no C. So djdijak@gmail.com. If you could send me an email or information on that, that'd be great. We really are looking for, if you think she'd be willing or he'd be willing to be interviewed on this topic, it'd be great.
Okay.
So, we're looking to try to get like maybe 5 social workers. So, and
okay.
then
I'm sure she'll do it.
Yeah. And then just to remind everyone, we have our call always the third Thursday. That'll change now with daylight savings. So it'll be 2:00 Eastern Standard Time, starting with November. We do I'm on the T-type call. We did have that last Tuesday. I did tell them what U.N.I.T.E was doing. They're not going to have a T-type call, the Tribal Technical Advisory Group. They're not going to have that call in November because they're having some meetings in Washington, D.C., and so there's some updates on that. But definitely go to cms.gov, Outreach and Education, American Indian, Alaska Native, and take a look at all the resources that are there for long-term support services, because there's a lot, and John talked about that too on the call. Really getting people to take a look at those resources that were put together. So, but that's always the second. So we're having our steering calls the second and fourth Monday. The TTAG call is the second Tuesday. Our monthly call is the third Thursday, and then the webinar is always the fourth Wednesday, and I do believe that is next week, right, Jonathan?
Yes, that's correct.
Okay, and what is the webinar on next week?
Sorry.
Do you remember?
I'm sorry. Yeah,
I don't remember.
I can tell you.
Okay.
It is on. It's on Tribal State Elder Justice Collaboration.
Okay, right. Okay,
yeah.
So that would be Wednesday the 24th, right?
Yeah, and it's Simple Account is the main presenter for that webinar.
She's going to be the main speaker on that?
Mm-hmm. Yep.
Okay, excellent. So if you all have a chance. And that's always is that 2 o'clock Eastern time? No, 2 o'clock Eastern time, right?
Yes, that's correct. Mm-hmm.
Okay. All right, so 2 o'clock Eastern Standard Time next Wednesday, and I believe you'll send that reminder out to all the U.N.I.T.E Collaborative, right? You'll send that out?
Yes. Mm-hmm.
Okay, so you can get registered. All right. Is there anything else, Jonathan, that KEI, anything else we need to know or think about?
No, not right now.
Okay. I think we'll need to put Kim and Deb into our emails to make sure they get, the minutes and all that stuff. We'll need to make sure we do that. And I think Ron had sent, and Jessica had sent some new emails. So we just want to make sure we keep our email database current for everyone. Okay, Ron,
send me those updated.
I'm sorry, what?
If you send me those updated emails, I'll make sure that Julie has them and we get them updated.
All right. So please, anyone that you've got someone you want to add, and if you look at the U.N.I.T.E newsletter, there's a link there too where you can join. You can join just by clicking on the link too, and it goes directly to KEI without going through a third person. So that's nice too. Okay, Ron, did you want to kind of give everyone an update on where we are on the nonprofit?
You bet. So U.N.I.T.E is official. We are registered and incorporated as a nonprofit. We have an employer identification number. So when we get employees, we'll be able to file their taxes. We're in the process of filling out the nonprofit status with IRS. It's called a Form 1023. It's fairly lengthy and fairly complex. One of the things that we'll need is a list of all the board members and their addresses. And so, Debbie, I'll probably work with you on that. Once we get 95% of the 1023 filled out, we will send it to the board for their review and approval. And then once we get the new board's approval, we'll submit the 1023. It normally takes 4-5 months for the IRS to approve our nonprofit status, but there should be no problem to that. And once we have that, then we can go seek grants and other funding because, people will be able to give us money as a deduction. So that's part of the reasons why we're doing it. And we're on our way. We've talked about wanting to get together to do some strategic planning. We're thinking the end of January down in the Phoenix area.
Mm-hmm.
We will start to put together some of the more boilerplate bylaw information that most companies have. There will be pieces to the bylaws that will be unique to U.N.I.T.E, and then that's where we'll probably have some discussion around membership and other items that are going to take a little bit more thought. But, some of the easy stuff about bylaws, we'll start working on that for the board's review also. It's kind of it in a nutshell.
Mhm. Right, and yes, and that's very nice how you put that. It's very easy to understand that. We do have a document that we're working off of that Susan White, who I met at the Title VI conference, she consults with tribes, and she's willing to, without any cost to us, just kind of work with us. Susan White is the senior partner for ACKCO Inc., a private Indian professional service, and she lives up on the Navajo Nation here in Arizona. But I did reach out to her after our last steering meeting and told her what we were doing with the nonprofit, and she is willing to meet with us that last weekend in January, to help us with the strategic planning or any pieces that we still need on the bylaws. So that's really good because we're getting some basically help with no cost, someone who's extremely qualified. So we've got that set. And as far as board members, Francis Stout, we're looking at people who are currently on the steering committee. So we have myself, Joseph Ray, Ina, Tammy, Ron. We did reach out to Francis Stout, and she agreed to be on the board. She's at our 300 Senior Skilled Nursing Facility on the board. And Ron, I don't think Blythe is able to do it. I think she's just got too many other things on her plate.
Okay, and then Val wants to be on too.
Melissa Heflin in Alaska is a charter member, and we did reach out to her. I think I saw her email. We're going to see if we can get some help getting her here in January, because I think she would do it if we could get her here.
And then Val wants to be on too.
Oh, Val. Yeah, that's right. Val Trail in Costa View, Alaska. So we're looking at Val, Tammy, Ina, Ron, myself, Joseph, and Francis, and then possibly Melissa, right? Is that right?
Yeah, I'd have to count it up myself.
Yeah, so that would be 1, 2, 3, 4, 5, 6, 7. That would be 8. And I think we talked about having 7 to 9 board members is what we kind of looked at to start with.
Yeah.
So these would be staggering terms. It doesn't mean you're going to be on the board forever, but we have to have some kind of structure in place to really get this off the ground and to get funding. And I think, honestly, I know this seems probably like, is this ever going to happen? But I think if we all stay committed, keep calling in, please keep talking about U.N.I.T.E and what's happening. I honestly think and have a vision that this could really, really turn out to be something that's going to be incredibly helpful to tribes down the road and to their elders and really to kind of, like Joseph said, kind of put together all these patchwork pieces that have been going on for so long. I think that this could be a wonderful opportunity to put that together. And we have a lot of contacts and a lot of people that are on our side, so it's really good. We have a lot of committed stakeholders, which is really, really good. Let's see. Anything else? Anyone have anything else they want to discuss or we need to talk about? All right, it's 1 o'clock. I'm going to go ahead and end the call. But Kim, if you or Deb could please stay on the call for just a minute, if we can exchange phone numbers and maybe set up a conference call, that'd be great.
Yeah. Okay, we will.
All right, thank you. Okay, everyone else, it'll be the third Thursday, 2 o'clock Eastern time. It's because of the daylight savings change. The next steering call will be Monday, and Ron will be leading that because Joseph and I will try to send some pictures too from NCAI. If you have pictures, especially at the facilities, please send the pictures to Ron or myself. We'll get them to KAI for the newsletter. It's really helpful to see pictures of where we are. I think that's super helpful in our newsletter.
Thanks, Debbie.
All right. Thanks, everyone. Bye-bye.